Studies suggest that 1 out of every 4 anti-neoplastic drugs in development is oral. Some of these oral drugs have revolutionized the way we treat certain cancers. While oral cancer therapy affords several benefits, not the least of which is convenience, and you can see convenience is listed at the top of the list of benefits, significant limitations remain. Because patients on oral cancer therapy have less contact with their healthcare team, there's the convenience factor, they may not be as engaged, they may not feel as supported, and they may not adhere to their treatment the way we would want them to. We know that patients who do not adhere to their oral chemotherapy regimen most likely will have poorer outcomes, will use more healthcare resources, and will have an increased risk of toxicity from these drugs. Unfortunately, it's very challenging to assess adherence, and often we are left to depend on the patient's self-report. The gravity of this issue prompted me to reflect on what tools might address this problem and improve adherence of patients taking oral medications to treat their cancer. Initially, I envisioned a program that included classes, supportive phone calls, and even potentially home visits. It was not until I did an extensive Google search that I discovered the various products that exist in a category called adherence technology. Now, within this category, I found cell phone apps to remind patients to take their medication, computer games to enhance decision-making skills, automated pill boxes, and pharmacy programs that provided support through reminder phone calls. While there were many novel ideas, none of them entirely encompassed the support, education, and tracking components altogether that I was looking for. Through this research, though, I did abandon the idea of a support program and began thinking more along the lines of a technological device that patients would use at home, thus preserving the convenience of oral cancer therapy, but adding an extra layer of support. I was not yet sure whether I would improve on the cell phone app idea or develop a standalone device, an entirely different device altogether. Imagine the perils of prescribing toxic therapy for your patient to take in the comfort of their home without oversight or immediate monitoring. This is a reality for many patients taking one of more than 30 oral cancer therapies, and more on the horizon. These patients are taking toxic medications outside the structure of the healthcare facility. While there are many benefits to oral therapies, the risk of missed doses, doses taken in the wrong quantity, or doses taken at the wrong time pose a serious threat to a patient's health. Now imagine a handheld device that is dispensed at the time of the oral cancer therapy, is programmed to the specifications of the patient's healthcare team, issues reminder alerts, provides important information, and can scan and record each medication dose. This easy-to-use, companionable device offers support and education for patients who are taking oral medications to treat their cancer. The companion's compact, user-friendly design make it ideal for older adults who may struggle with technology but desperately need the extra support. This device has the potential to decrease healthcare costs both by reducing patient complications and by increasing the efficacy of the expensive oral cancer therapy through improved adherence. This innovation is not dependent on use of a smartphone and has the capacity to support, educate, and track adherence. Oral cancer therapy enhances patients' quality of life. Invest in safety and optimize outcomes for patients on these medications by making the companion a part of your practice and your patients' lives. Now, this innovation fits nicely into the framework for innovation by addressing how the patient's needs are met through information technology that is initiated by the provider and the healthcare team and results in improvements in quality of care, decreased healthcare costs, and better outcomes. In order to make the companion handheld device a reality, the resources that would be needed, you can see money is at the top of the list, financial backing, financial resources, but also buy-in from key stakeholders. Buy-in from several parties. Nurses and physicians and other members of the healthcare team would need to recognize the limitations of oral cancer therapy and embrace the companion as a means to address them. You can see here the list of the key stakeholders in the innovation process, and one of those stakeholders is patients. Patients would need to acknowledge the device as a valuable means of support and information so that they would actually use the device. Adherence to the adherence device, if you will. And finally, and importantly, third-party payers would need to see the companion as the cost savings device that it is, so that it could be covered by insurance. Because it's not uncommon for oral cancer therapies to cost thousands of dollars per month, a reasonable additional cost to ensure that the medication is taken as it should be makes sense. After all, it's useless for an insurance company to pay the prohibitive cost of the drug without any interest in mechanisms that will make the patient more successful and prevent costly complications. In the end, patients with cancer need support. With the companion device, they are able to receive guidance and support regarding their oral cancer therapy without leaving the comfort of their home. This represents a huge improvement. Thank you.